A 72-year-old man walks into my office with the concern of this coming on his face since few months now. Now the lesion was there, but then it had increased progressively in last few months, and that was really bothering him because it was really right on the face, and his family members thought, it's looking very odd. So when I took a closer look at it, it is basically called as seborrheric keratosis. It's basically a benign skin tumor. It's not a cancerous one, but it's a tumor coming from the outer layers of the skin. And if you see, it's like a stuck-on, waxy, black, brown kind of, it's a very dense kind of a tumor coming on the skin surface, and it's very localized. There's no redness, there's no burning, no other symptom except for a cosmetic, unappealing kind of a look, and it really looks ugly for few people. So basically, it may be familial, it may be because of the excessive exposure to the sun, and if you really do not like, then you can opt to get it removed, like this gentleman who came into my office. So there are two basically options to get that removed. One is cryosurgery, so that's done with a liquid nitrogen at a very low temperature, as low as minus 200 degrees centigrade, and it's like a liquid nitrogen gas spray, but sometimes this leaves a black mark. Second one, treatment which I opted for, and I removed the growth with that, is called as the RF monopolar electrocautery, we call it as. It's a machine in which a single beam of light is passed through a small probe, and which actually destroys the entire growth of the tumor, and it nicely slices it off. At the same time, it can coagulate and plug off the blood vessels which have grown around it and into it, and you can really do a very clean job with this kind of a machine. So we could very happily treat him, remove that off, and when I actually took a very closer look, there were few which were also hanging on his eyelid and around the face. So seborrheric keratosis can occur on the face, on the chest, on the upper back, on the arms as well, and it can persist from many years, but it may also have a rapid development period in which the patient feels that he's suddenly got so many of them. Most of the people ignore it in the beginning because it really doesn't harm them, doesn't have any symptoms, but with this client, he really had some hanging ones on the eyelids, and the family was saying that it's really looking ugly, and that's when he approached. So my concern is that before it really gets on to this kind of a size, which is actually ugly, and it may give you a little different suspicious diagnosis, please approach the doctor, get it removed. It's a simple and a very common benign tumor, so we can get it done even in an OPD clinic, and get it removed. So cosmetically, you get a better appealing look. Once it is removed, you may have a little bit of a downtime, like you may have a scab for about 7 to 10 days, and once the skin heals up from below, the scab falls down. So this is about seborrheric keratosis. Please be aware, it's benign, it's on the skin surface, and it comes with a progressing age. See you soon.